Oh, the early victims of this pandemic were people in nursing homes. More than 9,000 residents of California's nursing homes died of COVID. Investigative reporter Jaxon Van Derbeken reviewed inspection records and found safety lapses led to major outbreaks in Bay Area nursing homes. But so far, regulators have done little to crack down on even the worst offenders.
They should have done the proactive thing and gotten her to the hospital in time.
19 elderly residents died here at Gateway Care in Hayward, among the hardest hit nursing homes in the Bay Area.
My grandmother was in the second room right there from the end, and that's the last time we saw her alive.
Union City Council member Jaime Patino said he was lucky to talk to his grandma Emma through the window of her room. 3 days later, she died alone in the hospital.
And that was a very hard thing, you know, a lot of tears and a lot of crying.
Today, Patino wants action taken against nursing homes with serious safety lapses.
There should be some accountability here. You know, these were common sense things that we all knew.
So far, however, Gateway has not faced any penalty, even though state public health inspectors found in April of last year that management failed to properly screen or protect staff from the virus, and even let one sick worker stay on the job, infecting 13 residents. In all, more than 75 residents and staff were infected. The owners, who recently renamed the facility St. Patrick's Post-Acute, never responded to our interview request.
Yeah, I didn't even know they had changed the sign, the name.
Our review of inspection records found that 17 of the 20 nursing homes with the most deaths, like Gateway, had at least one COVID-related violation. But so far, only 4 have been fined for the many lapses the regulators found. Even in the 4 instances where inspectors found that violations posed a major immediate health hazard, regulators have only sought fines in 1 case so far.
I think when the pandemic hit, there was an immediate knee-jerk desire to do something.
Michael Wasserman, president of the California Association of Long-Term Care Medicine, says fining alone is not the answer. He says the state needs to listen to the experts about what can be done to improve care.
A system where we pull money out of a poorly performing nursing home is not necessarily going to solve the problem and hasn't solved that problem before.
Most of these deaths could have been prevented.
But UCSF Public Health Professor Emeritus Charlene Harrington, who specializes in nursing home safety, worries about the fallout from lax enforcement early on.
I think if we had made an example of some of the worst violators early on, that would have sent a message.
The state public health department contends simply fining homes could have been counterproductive. We needed to find solutions to save as many lives as we could, the agency told us in a statement, adding there still is a chance that fines could be levied.
It's been a ignored and forgotten population for decades.
State Senator Henry Stern is pushing a package of bills known as the PROTECT Plan. He wants more transparency and patient safety protections.
So we've got to fix some of these underlying structural problems in the system and have some consequence out there when folks cut corners.
She probably would have lived.
After losing his grandmother, Patino wants to keep all options on the table.
We need transparency, more accountability, stiffer penalties, and for damn sure, I don't want to see any legislation that's going to give these nursing homes immunity.
Jaxon Van Derbeken, NBC, Bay Area News.
If you have a story tip for us, give us a call to reach our investigative unit, 888-996-TIPS, or visit our website, nbcbayarea.com/investigation.